do you or a family member wake up almost every morning with a persistent headache? Or even before the day has truly begun? Do you feel an unusual fatigue or heaviness around your neck and shoulders? Many people write off these symptoms as stress, lack of adequate rest, or simply related to getting older. But what if they are signs of more serious health issues? Every single day, second by second, what if an invisible force is placing excessive pressure on your blood vessels, quietly and slowly damaging your heart, brain, kidneys, and eyes without showing any obvious symptoms? This is high blood pressure, or hypertension, known as the silent killer. Many people feel completely healthy because the disease progresses slowly and silently. For this reason, hypertension is called a silent killer. Millions of people around the world have high blood pressure without realizing it, and many only discover it after suffering a severe medical emergency such as a heart attack, stroke, heart failure, kidney disease, or vision loss. The good news is that blood pressure can often be controlled by following a healthy lifestyle and getting appropriate medical care. However, rather than immediately talking about standard medications today, we will explore an intriguing question that has captured the attention of scientists for decades. Can one of the simplest things in our kitchen actually help lower blood pressure? This substance is garlic. People have used garlic as a traditional medicine for thousands of years. But what do modern medical studies actually say? Can garlic really lower blood pressure? How does it work inside our bodies? How many grams should a person take? Is eating raw garlic alone sufficient? Who should not use it? Can it interact with medications? Today, we will answer all of these questions based on sound and accessible scientific evidence. Stay with us until the very end. You might be surprised by the findings of modern studies. Garlic and high blood pressure. What does the evidence say? Garlic Allium sativum has been used for centuries in traditional medicine across many cultures. Historically, people believed it could help fight infections, improve circulation, and promote general health. Today, researchers have tested many of these traditional claims through carefully designed clinical trials. Over the past decades, dozens of randomized controlled trials and several systematic reviews have investigated whether garlic supplementation can reduce blood pressure overall. The scientific evidence is encouraging. Multiple meta-analyses have shown that garlic supplementation can significantly reduce blood pressure, particularly in people who already have hypertension. In many studies, systolic blood pressure, the upper number, decreased by approximately 8 to 10 millimeters of mercury, while diastolic blood pressure, the lower number, decreased by around 5 to 6 millimeters of mercury. These reductions may sound small. However, in medicine, even modest decreases in blood pressure can substantially reduce the long-term risk of stroke, heart attack, heart failure, and cardiovascular death. Nevertheless, it is important to understand one critical point. Garlic is not a replacement for prescribed blood pressure medication. Instead, current evidence suggests it may serve as a useful complementary therapy alongside healthy lifestyle changes and medical treatment. What have clinical studies found? Researchers have examined different forms of garlic, including fresh garlic, garlic powder, aged garlic extract, and standardized garlic supplements. One clinical trial followed people with uncontrolled hypertension who took aged garlic extract every day for several weeks. Compared with participants receiving a placebo, those taking garlic experienced meaningful reductions in blood pressure. Other randomized studies reported similar findings. Patients who consistently consumed standardized garlic preparations often showed improvements not only in blood pressure but also in blood vessel function. Some studies even found that garlic helped reduce arterial stiffness, allowing blood vessels to become more flexible. Healthier arteries mean the heart does not have to work as hard to pump blood throughout the body. Researchers have also observed improvements in blood circulation and endothelial function. The endothelium is the delicate inner lining of blood vessels. When this lining becomes damaged, blood vessels lose their ability to relax properly, contributing to hypertension. Garlic appears to help restore some of this normal function. Although not every clinical study produced identical results, the overall body of evidence suggests that garlic supplementation can provide measurable cardiovascular benefits. How does garlic lower blood pressure? Garlic works through several biological mechanisms rather than a single pathway. Its most famous active compound is allicin. Interestingly, fresh garlic does not naturally contain allicin. Instead, garlic contains a compound called allicin and an enzyme called allinase. When garlic is crushed, chopped, or finely minced, these two components react together and rapidly produce allicin. Allicin is responsible for garlic's characteristic smell and many of its biological effects. Garlic also contains numerous other sulfur-containing compounds that contribute to its health benefits. Together, these natural compounds may help lower blood pressure in several ways. First, they stimulate the production of nitric oxide. Nitric oxide is a natural molecule produced by the body that relaxes the smooth muscles inside blood vessel walls. When blood vessels relax, they widen. This process, known as vasodilation, allows blood to flow more easily and reduces blood pressure. Second, garlic possesses strong antioxidant properties. Oxidative stress damages blood vessels and contributes to hypertension by reducing oxidative stress. Garlic helps protect the vascular system. Third, garlic has anti-inflammatory effects. Chronic inflammation contributes to the development of cardiovascular disease. Reducing inflammation may improve long-term vascular health. Some evidence also suggests that garlic may reduce the activity of certain enzymes involved in blood vessel constriction, producing effects somewhat similar to some blood pressure medications. Although much milder, these combined mechanisms explain why garlic appears to influence. How should garlic be prepared? Preparation matters. Simply swallowing an intact garlic clove provides much less allicin than properly preparing it. For maximum allicin formation, take 1 or 2 fresh garlic cloves. Crush, chop, or finely mince them. Then allow the crushed garlic to sit exposed to the air for approximately 10 minutes before eating or cooking. This waiting period allows the enzyme allinase enough time to convert allicin into allicin. If garlic is immediately exposed to high heat after crushing, much of this beneficial reaction may never occur. Therefore, if you cook garlic, consider crushing it first, waiting about 10 minutes, and then adding it toward the end of cooking rather than exposing it to prolonged high temperatures. This simple preparation. What dose of garlic has been studied? Clinical studies have used various doses depending on the preparation. For fresh raw garlic, research generally corresponds to approximately 1 to 3 grams daily, which is roughly 1 to 2 medium-sized cloves. Studies using aged garlic extract or standardized supplements follow different dosing because the active compounds are concentrated and carefully measured. If someone prefers supplements instead of fresh garlic, choosing standardized products used in clinical research is generally more appropriate. Is garlic safe? For most healthy adults, garlic consumed in normal dietary amounts is considered safe. However, consuming large quantities may cause unwanted effects. Some people experience stomach irritation, heartburn, indigestion, gas, nausea, bad breath, body odor. Eating raw garlic on an empty stomach may increase gastrointestinal discomfort in sensitive individuals. Rarely, prolonged handling of raw garlic can also irritate the skin. Most side effects are mild, but moderation is important. Natural does not automatically mean harmless. Can garlic interact with medicines? Yes. This is one of the most important points to remember. Garlic has natural antiplatelet properties, meaning it can reduce the ability of blood platelets to stick together. Because of this effect, garlic may increase bleeding risk when combined with medications such as warfarin, aspirin, clopidogrel, other blood-thinning medicines. People taking these medications should consult their healthcare provider before using high-dose garlic supplements. Garlic may also enhance the blood pressure-lowering effects of prescribed antihypertensive medications. Although this can sometimes be beneficial, it may occasionally lead to excessively low blood pressure, causing dizziness or fainting. Individuals scheduled for surgery are generally advised to stop garlic supplements about 2 weeks before their procedure to reduce bleeding risk. These precautions mainly apply to So, what have we learned today? Modern scientific evidence suggests that garlic can help lower blood pressure, particularly in people with hypertension. Its natural sulfur compounds improve blood vessel function, stimulate nitric oxide production, reduce oxidative stress, and decrease inflammation. When properly prepared and consumed in appropriate amounts, garlic may become a valuable part of an overall heart-healthy lifestyle. However, garlic is not a miracle cure. It cannot replace prescribed blood pressure medications. The most effective approach to controlling hypertension combines a healthy, balanced diet, regular physical activity, maintaining a healthy body weight, limiting excess salt intake, avoiding smoking, taking prescribed medications as directed, regular blood pressure monitoring, routine follow-up with healthcare professionals. Think of garlic as one helpful tool, not the entire treatment plan. Always base your health decisions on reliable scientific evidence rather than myths or exaggerated claims. Your heart, your blood vessels, and your future health deserve nothing less. Thank you for watching. If you found this video helpful, please like, subscribe, and share it with your family and friends. Together, we can fight misinformation with science and make healthier choices every day. Follow